I wonder if we could start with Ukraine. Is this a de facto invasion?
Look, we're waking up to a very dark day in Europe, and it's clear from what we've already seen and found out today that the Russians, President Putin, has decided to attack the sovereignty of Ukraine and its territorial integrity. We've always said that's completely unacceptable. We've seen that he has recognized these breakaway eastern regions in Ukraine, and from the reports, I think we can already tell that he's sent in tanks and troops. So I think from that you can conclude that the invasion of Ukraine has begun.
What are we going to do about it?
There's a COBRA meeting taking place right now, chaired by the Prime Minister, and of course that will be discussing what action we will take. We have been very clear right from the start of this crisis that we wouldn't hesitate to take action. I understand that the Prime Minister spoke to President Zelensky of Ukraine last night, assured him of our support, but also that we will be introducing sanctions, as we said we always will.
What sort of military support can we offer?
We've already been providing military support to Ukraine now for a number of months, and certainly that's picked up in the last few weeks. I'm sure that will be part of the discussion at the COBRA meeting, and we will continue to provide such support, but also look at how we can take action against Russia through sanctions. And there are measures that can be taken because of legislation that we had introduced last year that will help in responding very quickly. And I'm sure that we make those sanctions targeted as possible to the people that are responsible for this flagrant violation of international law.
I got the impression that there were sort of two tiers of economic sanctions. Are we still going to do that, or are we just going to hit him hard?
Well, I think I'd want to wait for the outcome of the COBRA meeting. I think that is appropriate. And I know that after that meeting is concluded, the Prime Minister will make a statement to Parliament and set out what we know about the current situation on the ground, but also what action we will take.
The weaponry at the moment is defensive. Are we going to send offensive weaponry?
Again, I think that these will be exactly the things that are rightly discussed in the COBRA meeting, where the ministers at that meeting will be presented with all the latest information, intelligence, including from our allies across NATO. And once that meeting has concluded, I think it is right that the Prime Minister sets out the action to Parliament first.
Just another question on that, and then we'll move on to COVID, if I may. What should Brits do that are in these two breakaway regions at the moment?
Well, we've already advised British citizens to leave Ukraine, and I hope that all British citizens have been following that advice. Of course, not everyone does. And my understanding is that there are still commercial flights available. People are still able to leave Ukraine, and we would continue to advise those individuals, British citizens, to leave Ukraine.
So get out if you can.
Yes.
And just a final thought on that, if I may. There was a statement overnight from the White House talking about basically a communique between the United States and France and Germany, and a couple of times referring to those three nations. Why are we not included in that?
Well, I haven't seen the particular communique that you refer to, but you can see, I think everyone, it's been evident over the last few weeks how important a role the UK has played in this crisis, working with our allies across NATO in the conversations the Prime Minister himself has been having with the presidents and leaders of different countries within NATO, and also what the Prime Minister had to say himself at the recent Munich conference.
Something that will very much be troubling my viewers this morning, and I know you'll want to clear up, all restrictions dropped as far as COVID is concerned from Thursday. How are we going to future-proof against variants?
So yesterday was a historic day. We were already the freest country in Europe, and yesterday we were able to go further thanks to the protections we've built, but also the efforts of the British people. And I think it's worth remembering that the restrictions that we had introduced, of course, they had an important purpose, but they were never intended to become a way of life. You know, they also came at huge cost to our freedoms, education, mental health, and other significant costs. So being able to remove them in the way that we did yesterday was a significant step forward. But of course, we do need to remain vigilant. So that means we keep hold of our primary defences, especially vaccines. If we look at the last few months, I think the one thing, if we had to make just one thing that made the biggest difference of all, was our booster programme. We were the first country in Europe to be able to boost 50% of our adult population. Now it's over 70%. And that's also, by the way, one of the reasons I accepted the advice of the JCVI yesterday to offer a second booster in the spring to those aged over 75, elderly people in care homes and the immunosuppressed.
And then another one in September for over 50s, is that right?
Well, there may be. I mean, what the JCVI said yesterday, that is their current view, but of course they will keep that under review. But there may well be, I think it's likely there will be one in the winter, but we can't say at this point for what age group that will be. And again, we will listen to the JCVI at that time. But certainly for the spring, there will be one for the group of people that the JCVI set out. In terms of your particular question, though, about future variants.
Future-proofing,
and that is, it is right. We have to understand that clearly, COVID is still out there. We may be done with COVID, but it's certainly not done with us. And we have to remain cautious and vigilant. And that is why we set out yesterday also just how we will continue to do that. So vaccines remain an important part of our defences. The antivirals and other treatments that we have also will play a continued important role. But also we've put in place a surveillance system that we're able to detect any potential future threats, and also the ability for us to react quickly should that happen.
Great way to do that would be to keep lateral flow tests. You're not going to do that. We understand that it's going to cost something like £2 billion a month. Seems like an awful lot of money. Should we have free COVID tests, lateral flow tests for some groups?
We will be keeping free lateral tests for some groups, for the most vulnerable. So, for example, I mentioned a moment ago we have antivirals. So these are fantastic new drugs specifically designed for COVID. They played a huge role over Omicron, and they will continue to play an important role. So for people that are eligible for those drugs, we've targeted those at what we call the clinically extremely vulnerable, as defined by the NHS. It's about 1.3 million people. And for them, whether it's PCRs or any other testing that we require to make sure that we know when we need to offer those drugs to protect them, so we have testing in place. We will have lateral flow tests for staff for the time being. We will keep it for staff in care homes.
Until when?
We will keep it under review. So that is the decisions we announced yesterday for certain vulnerable settings, essentially care homes and hospitals. Lateral flow tests and PCR tests in some cases will continue to be used.
But to all intents and purposes, people won't know if they've got COVID or not, will they, from the 1st of April?
They won't. They won't. Without a test, of course, you won't know. So
you could go to work with COVID?
Well, you could go to work with flu. And the reason I say that is that one of the things that the Prime Minister rightly said yesterday is we've got to learn to live with COVID as we have learned to live with other respiratory diseases. If someone thinks that they might have flu, they don't need to take a test. You recognise the symptoms, and ideally you would stay away from work. You don't want to infect your colleagues or friends, and that is how we have lived with viruses. And now with COVID, obviously we couldn't have done anything like that at the start of COVID and throughout most of the pandemic because we didn't have the tools that we have today. But the situation today is very different. Yeah, but
the Prime Minister did say that we need to have the German attitude to calling in sick, which basically is if you're unwell, you should call in sick. The Germans, apparently the sick pay is 50% pay for 84 weeks. Ours is £96.35. You can see why people go to work, even when they're feeling unwell.
We have a statutory...
Should we look at that again?
Look, you're referring to our statutory sick pay levels, fairly. Most businesses, most employers pay a lot more than that. I mean, that is a minimum.
Some don't, though, Secretary of State.
You're right. That's why I said I recognise that, and that's why I said most. I didn't say all.
But it does put workers in a very difficult position.
It is important to keep levels of statutory sick pay and other benefits to keep that under review, and that is done at all times. But it is also right that we start moving back to normal. And I think this is a moment, what the government announced yesterday, it's a moment that we can all be proud of, because we've played a collective effort to reach this point.
But there are downsides to it, that's my point. So if you are at work and a colleague tests positive or you fear that they have got COVID, is it reasonable for you to tell your boss that you're going to go home?
I think if you feel that you've got COVID, just as if you feel you've got flu or some other virus that you shouldn't really be at work, of course it's reasonable to say to your boss that it might not be
what are you saying
sensible
to
for
those
you to set
employers
out.
who think that that's a bad idea, who wouldn't support that? You're saying, actually, you need to bear in mind how your workers might feel.
Yes, what we will be setting out is guidance, public health guidance. So for now, whilst we're removing the legal requirement to self-isolate from Thursday, there will be guidance that would advise you to continue to do so until the end of March. And from the 1st of April, we will set out new guidance that will be much more general, but still sensible guidance about how you might behave if you believe that you have some kind of respiratory or other disease. OK,
2 acronym questions before I let you go. These passenger locator forms, bane of travellers' lives, given that you don't have to self-isolate from Thursday if you do have COVID, are we going to get rid of them?
Well, I wouldn't go quite as far right now to say we'll get rid of them right away, but I do think now, with the measures that we've announced yesterday, there is a case to review them, and that review is being done right now with the Transport Secretary and the Home Office, and I'm sure some progress will be made.
And fixed penalty notices. Are you with the James Cleverly school of thinking, which is, doesn't matter if the Prime Minister has broken the law or not, he should continue on?
Look, I'm not going to get into this. We've discussed this so many times, Kay, and I think...
Yeah, but you never answered the question.
No, and the reason is that there are authorities, official authorities, that are looking into this whole issue, rightly so, and the Prime Minister himself has come to Parliament and apologised and set out what's happening, but also he's rightly not getting involved in what the authorities are doing. We'll let the authorities do their work. I don't think it's appropriate to get into this.
If he's misled Parliament, should he resign?
Well, as I said before, these are when you ask me questions with if and if this, these are hypothetical questions. I know you defined hypothetical for me before. And
yes, I did.
But that doesn't change it.
I'm glad that stayed with you.
So I've taken that away. But I'm not going to get into this. This is I'm focused on what's actually with regard to this. The Prime Minister has come to Parliament, authorities investigating this, but I'm focused on my day-to-day job.